So, welcome everyone to our Living Well for Better Health with Chronic Conditions, Session 0. My name is Liza, and this is my partner Cheryl. We'll be the facilitators for this Session 0 sampling of some of the activities that we present in the actual Living Well for Better Health program. So, what is Living Well for Better Health? It's a chronic disease self-management program that Stanford University's Patient Education Research Center has developed under the direction of Dr. Kate Lorig. It's based on over 20 years of research for chronic disease management, and it's an evidence-based program.
So, what does that mean?
Well, to be evidence-based means several things. The program produced the hoped-for improvements to health and well-being. These results are due to the program itself, not to any other factors. The evaluation is peer-reviewed by experts in the field, and the program is endorsed by a federal agency or by a research organization, and it appears in their list of effective programs.
Okay, so this program, known in Maine, is Living Well for Better Health, and it's offered to adults with chronic conditions and to their families, their caregivers, and their friends. So it's a program of steps on how to live healthier, and it supports people with chronic conditions. It helps them take control of their health and improve the quality of their lives. So the program is a free workshop conducted in 2-hour sessions, 2.5-hour segments, once a week for 6 weeks. And it happens in community settings like churches, town offices, different places around our community. And workshops are run by 2 trained leaders like us, one or both of whom are non-healthcare professionals with a chronic disease themselves. So subjects that are covered, that they include how to deal with the challenges of frustration, fatigue, pain, isolation. We talk about physical activity, coming in at your own activity level, helping to maintain and improve your strength, flexibility, and endurance. We talk about the correct use of medications, how to have a better conversation with family, friends, and health professionals about your chronic condition. We talk about better nutrition and better and healthy eating, how to decide about new treatments, setting personal goals, and managing pain.
So it's the process in which the program is taught that makes it so effective. The participants, like you, will learn how to brainstorm, create goals that you can actually do, called action plans, work with others, problem solve, learn how to make daily tasks easier, find support and solutions to health concerns, and work in partnership with your healthcare team. For the program here in Maine, there is a license agreement between Stanford University and Spectrum Generations, our Central Maine Area Agency on Aging. We believe in this program so much that we took the training offered through Spectrum Generations to become facilitators. Now, over the 6 weeks of the workshop, we learn skills that are part of a self-management toolbox, and these address the elements in the symptom cycle. Those impact on our well-being. I want you to notice the relatedness between the skills and the symptoms. So the benefits of the program are improved activity levels, more confidence to deal with and manage symptoms, better communication with doctors, and fewer days spent in the hospital and fewer outpatient visits and hospitalizations.
So you may ask, what is a session 0? This is an actual session before the preliminary workshop begins. So it's an introduction to the Chronic Disease Self-Management, Living Well for Better Health workshop. And this is just a sampling of some of the activities that are going to happen throughout the workshop. So once you've sat in on today's activities, we are sure you're going to want to call Somerset Public Health and sign up to register. So with that in mind, at the end of the presentation, I believe there's going to be a phone number that will register for the program. It'll be displayed. And just be sure to write it down, grab a piece of paper and a pencil, write it on down. So for more information about upcoming workshops in the future. And wait, so with that said, we are now going to begin our activities. So I'm turning this over to Liza.
All right, so this is activity 2, the mind-body connection. And we've all heard about the connection between the mind and the body. We know that our mind can have an important influence on our bodies. We're going to look more closely at this relationship throughout the workshop and explore ways to manage symptoms. Right now, though, we're going to start with a thinking activity. So one of our self-managers once said, mind over matter, and mind matters. The mind is a very powerful tool. To demonstrate just how powerful and how it can affect your body, we're going to do a short activity. So, please sit back, close your eyes, get comfortable, feet flat on the floor, arms and hands relaxed in your lap or at your side. A breath in, and imagine you're holding a big, bright, yellow slice of lemon. Picture it in your mind. You can feel the texture of the lemon rind in your hand. Now lift the lemon up to your nose. You can smell its strong citrus aroma. Next, bring the lemon slice to your mouth and take a big bite out of the lemon. It's juicy. The juice squirts all through your mouth. You can taste the lemon juice filling your whole mouth. The juice even dribbles down your chin. You can suck the juice from that lemon. Now open your eyes when you're ready. So, what happened to your body while you were imagining the lemon juice in your mouth? Anybody?
This is where you give us feedback.
What was
You
that
can taste the
experience?
sourness.
Mm-hmm. I actually thought I noticed you sort of go a little bit. Was that true for anyone else? Mm-hmm. So, the salivation or the puckering that you might have experienced was just in your mind. Because none of us had lemons with us. So this is a simple example of how the mind can affect the body with very little effort. Just imagine what we could do if we learned ways to use that power to help us with our symptoms. So in this workshop, we'll learn several thinking techniques. Our job is to try the different methods and decide which one fits our needs. We'll learn distraction, relaxation body scan, and positive thinking. These techniques that involve using only your mind to manage the symptoms and help us feel better. Equally powerful and helpful are prayer and meditation. If this is an important part of your life, please continue to use those tools too. And now, activity 3, brainstorm.
So we're going to do a brainstorm. And the purpose of a brainstorm is to allow us to share many ideas about a topic as much as possible and to do it quickly. So to do this, here's my Vanna. We've got a chart to look over. So anyone can share.
And that does happen.
Yeah.
All
Real
right.
life. All right. Anyone can share. No commenting during the brainstorm about others' ideas, negative or positive. No questions until after the brainstorm is done. And clarification waits until after. When all the ideas are shared, we'll go over anything that might need clarification for anyone. Okay. So, we are going to brainstorm about the risk or fear of falling. And
Give me a moment to get
yeah.
this set up.
So our question is, what situation or places are risky for falling?
I need a pen.
Right.
Thank you.
All right. So,
Stairs.
Stairs. Anything else?
Bad weather.
Bad weather.
Wet floors.
Wet floors.
Ladders.
Ladders.
In the shower.
In the shower.
Poor lighting.
Good one. Poor lighting.
Small pets.
Small pets.
Uneven terrain outdoors.
Uneven terrain.
Help me with the spelling.
TERRAIN.
Thank you.
And by that you're referring to ground, right?
Yes.
And ground. Okay.
And uneven flooring.
Mm-hmm.
Area rugs too.
Yes.
Area rugs. Not bad.
When something's out of reach. Like if you're sitting in a chair and you can't quite reach the
Oh,
phone
how
and
would
you
you-
lean over and
Is there a way for me to write that briefly?
Being unbalanced. Would that work? Being unbalanced?
poor vision.
Poor vision. Couple more.
How about if you're hurrying?
Hurrying.
Walking while distracted. Like looking at a phone or
Texting and
Walking while distracted. All right, that looks like a really good
Yeah.
list. We'll go over them. Okay. So what situations or places are risky for falling? We have stairs, bad weather, wet floors, ladders, shower, poor lighting, small pets, uneven terrain, uneven flooring, area rugs, being unbalanced, poor vision, hurrying, walking while distracted. So those are some really good examples of risks. So I'm looking in my book here just to let you know what other things could possibly cause us to fall. So we've got cluttered rooms, incorrectly fitted assisted devices, and incorrectly using assisted devices as well, so canes or walkers, anything like that. I believe we have everything else. Or getting up at night to go to the bathroom. That could be a
And
problem.
poor fitting footwear is not on
Poor
our list.
footwear, yeah.
Yes,
Oh, yeah.
poor fitting footwear is another
Mhm.
one.
Okay,
Good list, group.
yes. So, there it is.
There it is.
So we have another chart just to look at some ways we could possibly reduce the risk of falling. So the first one is exercise. That's really important, and that just helps us increase our muscle strength, joint flexibility, and helps us improve our balance and posture. And there's plenty of examples that we can find in our Living a Healthy Life with Chronic Conditions book. Number 2 is have your vision and your hearing checked annually and correct as necessary. There's evidence that people with poor hearing or vision fall more often. You want to take care of your feet. You want to wear shoes that have a low sturdy heel, fit well, and have a non-slip textured sole, and they support your feet. Number 4, make your home safer. Make sure there's good lighting and keep areas where you walk tidy. Have handrails on both sides of stairs. Check all the carpets, make sure they're fixed firmly to the floor, and remove any small rugs that might scatter. Have grab bars next to the toilet and the tub, and use non-skid mats. Have telephones or a personal emergency alert pendant accessible in case of an emergency. Number 4 or 5, talk to your healthcare professional. So you want to report your falls, your near falls, and if you're afraid of falling, review all of your medications, prescriptions, and over-the-counter medicines. Have your balance checked. Report any dizziness or confusion. Have your blood pressure checked. Low blood pressure can make you dizzy and groggy when you stand up. Take a minute, stand up slowly, and get your balance. Ask if you could benefit from physical therapy, an exercise program, a home safety evaluation, or a device to help support you, like a cane or a walker. So a balance evaluation or a frog in my throat, a fall risk assessment by your healthcare professional is something you may want to consider if you have any of the following. So if you've fallen previously, or you have a fear of falling, you have difficulty walking, or you have difficulty with your balance, you use an assisted device for walking like a cane or a walker, you have spells of dizziness or confusion, you have more than one chronic condition, or you take medicine that might make you sleepy or dizzy. So if you're concerned about falling when you're by yourself, talk to your health professional about a personalized alert system. It's just a pendant that you can wear around your neck, and you can push it if you need any help. And that system is also monitored 24 hours a day. So as we mentioned earlier, there are exercises in the Living a Healthy Life book that can be good for balance. It goes over flexibility and strengthening exercises, and they're all in chapter 7, labeled with a BB for better balance, or else with a weight symbol. And it focuses on your trunk, your hips, your knees, and your ankles. So that's it for brainstorming. Thank you.
So next is activity 4. I'm just going to hang this back up here. Activity 4 is how to do an action plan. Okay. So sometimes it can be overwhelming to think about how to change what we want to make the change, and they seem just too big to work on all at once. So that makes it hard to get started. To help with this, one of the most important self-management tools in our toolbox is action planning. And action plans allow us to achieve what we want or decide to do by breaking down the activity into really smaller, doable parts or tasks. We do not need to do all the steps at once. We need to get started by deciding which step we're going to do on this week and exactly how we're going to do it. And here are the parts of the successful action plan. So, number one, something you want or decide to do, not what someone else tells you you should do or what you think you should do. It needs to be achievable, something you can expect to be able to do this week. Action specific. For example, losing weight is not actually an action or behavior, but replacing snacks with fruit between meals, that is action specific. Losing weight is the result of the actions. So you're answering these questions. What? The specific action. Walking or replacing junk food snacks with fruit. How much? It's measured in time, distance, or amount. It might be 30 minutes, or 4 blocks, or 1 portion. When? The time of day, or which days of the week. Maybe you plan to make this change just after dinner on Monday, Wednesday, and Friday. How often? The number of days in the week. 3 times. Twice a week. But avoid 7 days a week. And lastly, do you have a confidence level of 7 or more? Ask yourself on a scale where 0 is no confidence at all and 10 is complete confidence. We find that a confidence level of 7 is a good indication that you will be able to complete that action plan. So, to give you a sample of what an action plan looks like, we're going to share ours before we ask you to partner up and work on an action plan of your own for this next 7 days. So I'll start, and my action plan is to increase some muscle mass. So what I plan to do in the next 7 days, I'm going to start with 1 leg exercise and 1 arm exercise. I'm going to use 3-pound weights. I'm going to do 12 reps for each arm and each leg. And I'm going to do this 2 times this week, in the evening after dinner. I've looked over my calendar and with what I have going on in these next 7 days, I realized that Saturday and next Tuesday are the best evenings for me to commit to. So having made it that precise, I have a confidence level of 7.
Good luck with that.
Thank you. What about you, Cheryl?
Okay, so my action plan for this coming week is to cut out sweets after dinner during the work week.
All right. Yeah. Keep going.
And I did put down 5 days, which is the work week.
Mm-hmm.
So, I don't know, that's giving me a confidence level of maybe 5 at the moment. So,
All right, so to bring that confidence
Yeah.
level up,
I'll change that up. So if I do it for 4 days
okay,
instead of 5,
all right. And does that bring you up to a 7?
yeah, it gives me a 7, just in case I need something sweet.
Okay.
In the evening.
Good luck with that.
Thank you.
Okay. So, remember we said the action plan is something you want to do. And it needs to be achievable. So you have in front of you scraps of paper. There are pens there. We also have copies of what the action plan outline looks like. So talk it over with each other. Partner up so you can listen and think together. And we'll give you about 3 minutes and then tell you to change. So 6 minutes altogether. And by the magic of video, we're just going to speed that right around for a second. So our watching audience doesn't have to sit there for 6 minutes. But go ahead, and if you have any questions, please ask Cheryl and myself if the instructions aren't clear. All right. So it's sounding like we can come back into session, and it's time for some sharing. So do I have a volunteer who'd like to share their action plan?
I'll share.
Thank you, Jill. All right, so,
I would like to improve my eating habits, and the way I am going to do that is by adding vegetables to at least 2 meals every day during the work week. I have a pretty high confidence level that I can do that.
all right, so I heard adding vegetables to 2 meals each day.
Yes.
So you're going to do this for every day?
During the work week.
5 days. Okay.
Weekends have always been my challenge. With
Right. And you
eating
said a
well.
pretty high confidence level, but can you give it a number?
I'd say at least an 8.
Okay. Good luck with that then.
Thank you.
All right.
All right. And if we can just move this direction.
All right, I want to stay in touch with some college friends.
Mm-hmm.
I want to use a thank you note or a note card. I want to write 2 cards in the evening after the children go to sleep, before Facebook, next Tuesday and Thursday. I have a confidence level of an 8.
All right.
Oh,
Good
excellent.
luck with that.
Yes,
Yes.
good luck.
Thank you.
Sure. I'm going to practice yoga this week.
Mm-hmm.
I'm going to try to do 45 minutes, 3 days a week.
Mm-hmm.
I think Saturday, Sunday, and Tuesday are the best days. I've not decided morning or evening.
Okay.
And I have a 8 level of confidence.
Nice.
All right.
Good luck with that.
Thank you.
I'm going to start studying again for my GRE, half an hour a day. That'll be 5 days a week after work,
Mm-hmm.
and yes, and I have a confidence level of 7.
All right.
All right, good luck with that.
Ambitious group.
Yeah. All right, Sadie.
I'm gonna walk for 3 miles in the evening 3 times this week.
All right.
Tuesday, Wednesday, and Friday. And at least an 8, provided it doesn't rain on those days.
That's a good awareness.
Yes.
Yes. All right.
All right, good luck with that.
Mine was very similar. I was going to go for a 30-minute walk after dinner
Mhm.
3 times during the work week, and I have a confidence level of 7.
All
Awesome.
right. Good luck with that, everybody.
Yes, good job. So when we come back next week, which we're actually not going to do, but when we come back next week, we would report back and share how we did on our action plans.
That's right.
Yeah. All right.
So, I'm looking where I am here, find my place. So to wrap up, this is only a small sample of the many activities offered in the full 6-week program that the entire Living Well for Better Health is. We are sure you will want to be part of our next offering. So we're going to provide contact information once we really close this session 0. And in a moment, you'll see that information that you need to call to register and get information to be on a call list for future programs. And thank you so much for allowing us to come into your home today and share this informational session 0 with you. We are always available to answer any questions.
And thank you, participants.
Yes. Thank you all.